Well, good afternoon, everyone, and happy Wednesday. I am showing 1 p.m. Central Standard Time. Thank you all for being here today to learn more about the Action Planning Dashboard. This webinar is being recorded and will be posted to our website following today's session. We'll also be sending the recording along with the slides to all the participants, and that generally occurs about a week after the actual webinar. Please note we will be posting a PDF of the presentation today into the chat box. And there is an attachment of the action plan template, which is included on today's meeting invite for you to use during the practice session of the webinar today. In this session, participants will get an overview of the action planning template that you will start to see in consultations and discuss how to use the tool to support the implementation of the action plan. The objective is to gain a greater understanding of the importance of using a dashboard to really drive performance and learn how to improve performance through better project management. The goal is to assist organizational leaders with implementing best practices that result in performance improvements. Before we proceed, I'd like to introduce myself. My name is Shannon Sari, and I am one of the program specialists with the National Rural Health Resource Center, which is providing this webinar today. The Delta Region Community Health Systems Development Program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. We ask that you please connect your video feature by selecting the camera icon in the lower left corner of your screen. We ask that you please remain muted unless you have a question. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed into today's call, you can press *6 to unmute your line. You can also communicate through the chat box, which I will be monitoring, and that's located on the bottom ribbon in the middle of your screen. If you haven't already, we ask that you please take a moment to type your name, title, and organization into the chat box, really so we gain a better understanding of who's joining us today. So we do have 2 pre-polling questions that we would like you to answer before we get started on today's session. As you can see, Caleb just pulled up the poll questions, and as you all are answering those 2 questions, I would like to take a moment and introduce today's speaker. It is my pleasure to introduce today's presenter, Ms. Lindsay Corcoran. Lindsay is a senior consultant with Stroudwater Associates, focusing on sustaining healthcare access for rural communities through hospital operational improvement and affiliation strategies, and has assisted rural and community hospitals as well as clinics across the country to improve operational and financial performance. And on that note, I am going to pass it over to Miss Lindsay.
Great, thanks, Shannon. Let me do this fun thing. Okay, good. All right, great. So thanks everyone for joining. I know I see a lot of familiar faces, some of you have already, in this cohort, some have already experienced the action planning session. So are slightly familiar with the action plan document and dashboard that you all have received as part of this project. And so whether it was for the quality improvement side or the financial and operational improvement side, you may have experienced some of this dashboard, but lots of information that we're going to go over today and kind of break down that dashboard in a little bit more detail. Maybe it was just really quickly glossed over during your initial call. So we'll have some time to go over that today. And of course, certainly ask questions as we go along. So with that, we're going to talk a little bit about performance improvement. As Shannon said today, some of our learning objectives is first around getting a better understanding about the dashboard and some kind of best practices as it relates to driving performance improvement. We always like to say that we are continuously, evolving and trying to drive change and in performance improvement in our organizations, because if we were, status quo and not moving forward and continuously evolving, I don't think that we would be where we are today. So lots of things that we're going to get a chance to talk about today. And we'll hopefully leave you with these tools that you can not only apply for this project, but other, initiatives, priorities for your organization, applicable to and could be utilized with these dashboards. So again, the outline of today's webinar, we're going to go over some common pitfalls and how to navigate them as it relates to performance improvement. What are the 4 Ps of driving performance? And of course, we're going to go over the dashboards and the improvement tools that we have available for you. And then again, some best practices on performance improvement and how do we make change and navigate change within our organization and really hold folks accountable to performance improvement. And then obviously we'll have an opportunity for some Q&A. So what are some of those common pitfalls? What happens, what gets us stuck in a rut as it relates to performance improvement? Certainly a lack of a clear vision. If you don't, and it goes back to organizations that may have a mission vision, but they just don't follow it. There's nothing that ties what they do on a day-to-day basis to that mission and vision. So there's no kind of strategic direction of an organization. And so that's really hard to build, a performance improvement culture behind something that there's not a clear vision about. Lack of a project plan. So not having the steps in order to accomplish something. We need to kind of start foundationally and put some building blocks together to make, to really kind of get to that accomplished state. Not breaking down the project into manageable steps, similar to what I just said about the building blocks. You can't just, you've heard the term, bite off more than you can chew. It's the same with, implementing some type of new change. You have to start small and break it into pieces that are more manageable, that you'll have those small wins and those successes to continue to build upon. And we're going to go into all of that in just a moment. Doing too much. I mean, I'm sure you'll all have experienced like a plate full of lots of priorities, and you all are wearing multiple hats. You all work at rural hospitals and within the rural space, and we know that part of being a rural hospital and running a rural hospital is you wear a lot of hats. And so with that comes a lot of responsibilities, a lot of competing priorities for you. And so it, certainly something that happens a lot, that we just have too much and we can't get to that improvement state because we just have too much on our plate. Or we're just doing too much at the same time. And I think this might be oh, no, this is not our last one, but not tracking performance. So if we're not, we could be doing a lot of really great things, but we're not tracking the success of those. So how do we know if they're working or not? And so we could just be spinning that hamster wheel, thinking that we are improving on some aspect, but we're not tracking it. And that's why we always say, you know, you have to track and trend. You need to measure your performance over a period of time to really see if those initiatives that you've implemented are really kind of moving the needle. And lastly, we haven't identified owners. No, we have not kind of identified somebody who's going to be responsible for really owning whatever that initiative is related to performance improvement, and somebody that will be held accountable for. It's not really going to be the one that's going to take ownership of the whole entire thing, but somebody that is going to be assigning accountabilities and delegating and really pushing that movement forward. So, you know, these, you might think about your own organization to be like, oh, yep, you know, we're really stuck in this rut here, and we just haven't been able to get to kind of that performance improvement state. Well, you know, so that brings us to what we call the 4 Ps. So having a prioritization of what you want to do, having a plan, having a performance measurement system, and managing it all from a project management perspective will hopefully mitigate some of these pitfalls around driving performance improvement. So with that, we're going to go into what are the 4 Ps. And we're going to start with a little story. We always like stories, nothing like a story on a Wednesday afternoon. But if you've ever heard of Sir Edmund Hillary, and he had a dream. You know, he was a beekeeper who loved to climb, and he had a dream to climb to the top of Mount Everest, which is the world's tallest peak at 29,000 feet. And certainly this was something that was never heard of at the time in the 1950s. And it was certainly out of reach for a lot of humans. You know, I think airplanes were flying at that altitude. So to think about climbing Mount Everest at that time was just unheard of. But he certainly had a dream, and so he ended up being successful and accomplishing that dream, or what we also call is a big, hairy, audacious goal. And he actually summited Everest at the age of 33 in 1953. And he did that with his climbing partner. And he really, you know, this was something that was unheard of for the time. He was actually knighted by Queen Elizabeth. And he really set the motion for exploration by his feat, or his big, hairy, audacious goal that he succeeded in doing. And he really inspired a lot of additional explorers, and really left a legacy of exploration. His son and his climbing partner's son also summited, you know, Everest in 2002. So really cool to say that he just kind of was a trailblazer. And, you know, now when you think about climbing Everest, you may know somebody that climbed Everest, you know, which was, it's just crazy to think about. So he certainly had this dream, but he did not have this dream or this goal without making a plan. So he started with this dream, and he crafted a plan. He took that, you know, part of that plan was looking at what type of training he needed, what type of equipment and provisions, and the map that he was going to take, or the trails that he was going to take to get to the summit. You know, what was his support system going to be like? You know, what are the resources that he was going to need to make this a successful climb? He also broke down the plan into manageable milestones. So you can see here, you know, he started at the base camp, and then there was some time where how did he reach? He reached camp 1, and then, you know, because of those successes, he could continue to build on and reaching the additional camps all the way up until the summit. It was certainly an organized expedition. It was not just something that was planned the night before and just went out and did, although sometimes those can be good too, but maybe not when you're climbing Mount Everest. And it certainly took a team. You know, this was not a solo act. There was a lot of you know, team efforts and teamwork went into planning and executing this climb to the summit of Mount Everest. And you know, certainly the plan worked, and you know, progress is made and progress is monitored, because you know, as he got to camp 1 and reflected on his climb, and if there was something that he needed to do differently to get to camp 2, or you know, the next day or the next climb, you know, things were reassessed, or you know, if it didn't work, maybe it was good to try a different set of, you know, tools in my tool bag. And you can see, and then obviously there was celebration, and you know, because of that that climb and that success of that climb, there was lots of celebration and time for reflection on the whole climb. One thing I want to note though is you can see here is there's this old route, new route. And over time, as you know, Sir Edmund Hillary opened up the opportunity for lots of exploration and other folks to take his route up to the summit. Over time, they decided, you know, maybe this wasn't the best route. And so this might be the more efficient route. And so it, you know, the time that he traveled, or the time that others embarked on that same journey, the journey improved. So again, you know, hopefully you know, you can take this story and you can apply it to your organization. And it's really about kind of, how do we think about continuous improvement, or taking this goal or this dream that you have, creating a plan, getting a team together, executing, and you know, being successful, and really celebrating and reflecting on those successes. So just a nice little story to get you going. So back to the 4 Ps. So you could see that in that story, some of those Ps were applied to the story. So I just want to quickly go over, and then we're going to break each one of these Ps down. Again, if you have already used the dashboard before, you may be familiar with walking through this dashboard already. But the first is prioritization. So what are the priorities of the organization? What are the, you know, key initiatives that you all have decided that you want to implement based on a priority? Top priority, you know, trickle down to the lower priorities. And then those priorities, they tend to be connected to back to that vision and that mission of the organization. And they're kind of aligned with the organization's desire and direction overall. Then we move on to planning. So this is where you have your individual plans of those different priorities. So the planning, it really takes those priorities, kind of distills it, breaks it down into more manageable pieces. You build in action steps. We'll go over this in a little bit more detail, but you have action steps, you have measurable goals, you have accountabilities and owners, and it's time sensitive. So there's a timeline that are associated with each one of these initiatives. Then we go into performance monitoring. So it's the 3rd P. So this is really where it happens, where all the management of all of these initiatives can occur here. And then project management is looking at it big picture, with all of our priorities, all of our action plans flow into the project management. What's the big picture? Where are we at? And again, at the end of the day, you know, things can get reorganized. You know, you have a lot of, again, coming back to the competing priorities of the organization, all may fall, you know, in this project management dashboard. And we may have opportunities to kind of change it up a little bit depending on how they all fall. So again, we're going to go into each one of these components a little bit more. This one's pretty self-explanatory. These are, certainly identifying what is the most important initiatives for your organization. And then hey, Shannon, did everyone receive the Excel document?
It is in the Outlook invite.
Okay. So if you have the Outlook invite, you could open up that Excel document and follow along with this. There's different tabs. I think this is a yellow tab that's labeled like 1 through 10. So it's action plan 1, 2, 3, 4. So this takes, going back here. So say if we wrote in here, climb Mount Everest as our top priority initiative for the organization. Well, that number 1 here is going to flow into action plan number 1. So that's going to be your initiative identified by your organization. One thing that we're going to do is we're going to define who that owner is. Who is the owner, the primary person that's going to be responsible for the whole entire action plan, not just each one of these individual action steps, but the whole action plan. So who's going to be our Sherpa that's going to guide us to climb Mount Everest? And then what we want to do is also number 3 here in this little area here around issues. What is the problem? What are we trying to solve for? What is our current state versus our desired state? A lot of times we'll see, for instance, something very applicable to hospitals is our action plan is we want to grow our swing bed program. Our issue is we have a swing bed census of 0.2 and we should be having a swing bed census of 4. What's our current state versus our desired state? After that, once we've decided what our problem is and what our issue is, we're going to define what our goal is. And our goal tends to be what we want to see in more of a SMART model, if you will. Those are goals that are specific, measurable, attainable, realistic, and time-phased. So we want to make sure that we capture what our goal is related to that initiative. And then we have a target date. This is our anticipated date for the completion of our goal. So if we've said we wanted to increase our swing bed census to 4 by December 31st, 2022, our target date will be December 31st, 2022. And lastly, well, almost last, what are our action steps? So these are going to be what specifically are we going to do that these steps that build upon, these are the building blocks that build upon each other to get to our desired goal. What do we need to be doing at the organization to increase our swing bed census? What do we need to do to climb Mount Everest? Sir Edmund Hillary had, plan out the route, gather the supplies, things that he needed to do to achieve his goal. And then, and then lastly, it's really around who is the owner and by when. So this is who is the owner or who is going to be held accountable for that specific action step. And by when. We need to have a target to when that would be completed by. Really, this is a part of the action planning that hopes to hold folks accountable. And because we have assigned responsibilities and it's with a time commitment. Okay. Any questions on that action planning piece? All right. So the third P is really around the performance monitoring. Okay. So if you have that Excel document open, if you scroll towards the end of the document and all the different tabs, I think it's like the second to last tab, and it may be titled performance monitoring. I'm not sure. And so, but it does have this snapshot here. And so what this is it's going to auto-populate what your goal is. So back on your action planning document, this goal here in this cell here in that Excel file will auto-populate here, okay? So with that, so say we're going to use our swing bed. We want to increase our swing bed census to 4 by X date. Well, what is our measure going to be? So what are we trying to measure? Well, we're trying to measure average daily census. So, you're going to define what that performance metric will be to really measure the progress towards what your goal is. What is your baseline? So what are you currently at? Or your current, your starting point. So for a swing bed program with a 0.2 ADC today, that would be your baseline. And then what your target is. Define what we like to measure it kind of in monthly snapshots. So what do you hope to achieve on a monthly basis here? Your owner will also pull and auto-populate. So anything that's in these yellow cells requires an input. And then, so you can see here, we use kind of the stoplight form. These are going to be your results on a monthly basis. Your results are whether or not you're meeting target, above target, moving towards target, or below target. So based on a red, yellow, green. And so you would just highlight based on where you are on a monthly basis, are you getting to that target that you've set out for yourself? That makes sense. A lot of times when you're talking to the quality folks, they're doing this already. They're doing it with a lot of their quality improvement metrics that they're tracking. Department managers are looking at this type of stuff and kind of tracking it, tracking progress relative to a target or to a benchmark. So that's very important as we're really kind of monitoring on a regular basis where we're tracking towards that benchmark or that target. Do you have to say, as you're moving along over the months, if you're continuously not meeting your target or you're below your target, maybe there's opportunity to kind of reassess, and so we'll go into that in a little bit, but maybe that's something worth bringing back to the group and saying something's not working, or what do we need to do to start to move towards the target. And the last P is around project management. So RIS is really starting to break down the goal, and it's more of a Gantt chart. So it's a snapshot, again, a high level snapshot of the different goals that you've set out for your initiatives and the estimated time it's going to take that you've established with a start and an end date. And what does that look like from a timeline? So it's able to kind of see from a high level where your priorities are from a, implementation timeline, high level project management view. So you can see you'll have to populate the yellow areas. The white areas, again, pull over from that action plan tab. What is the estimated time for completion? Again, total, maybe it's months, maybe it's days. What are the start and end dates? That owner gets populated. And then you would just populate, highlight how many months back to that estimated time. So you can see 6 months here, we're going to highlight 6 months. And it'll look a little bit different, based on each one of your goals and in your associated timelines. Any questions there? Okay. Okay. So what we did was we really went through all of this very quickly. Let's see. Does anyone have any questions on the action planning document? I want to make sure that I have some time to. Okay. Does anyone have are you able to populate I'm going to actually share my screen. Is that okay? I can switch. Yep. Okay. Stop share. Okay. So you can all see this here again. And this is the document that you will receive. So here's the live version. This is also what's attached to the meeting invite. It's going to start. The first tab here has some instructions. So you can always reference back. This second tab again is the priority listing here. When we do meet with each other and we do the action planning, we like to do this exercise, taking these priority recommendations and look at it from a impact effort matrix. And so for some of you that have gone through some of the action planning, you've gone through this exercise, but it really takes in some of those initiatives that you've all decided are priorities for the organization and lets you understand a little bit about what's the effort in order to kind of implement that recommendation. Is there a lot of time and resources needed, or is it a little bit on the lower side? And then at the same time, what's going to be the impact of that initiative? Is it a really big, high impact, or is it more of the low impact here? And you can kind of see and we start to incorporate into our matrix where all of these initiatives lie. And then, as I said, we have the different action planning areas, this action plan here. You'll notice that we also have a year 1 here, and then we have a year 2 and a year 3. For the purposes of this year, you're all in year 1, right, Shannon? Yeah, okay. Okay, so you're all in year 1, so you don't have to worry about year 2 and year 3, but we put them years 2 and 3, which will have an action plan review. So we'll have a time to go back and kind of check in to see where you are relative to the first year. And but we wanted to make sure that we have a space that's capturing your original action plan, your year 2 action plan, if there's any changes, and the year 3 reassessment. So really the opportunity to kind of reassess where you are relative to your original action plan. So we want to make sure that we capture it all in the same document here. And then just want to quickly just show you the live version of the dashboard. As you saw on the screen here, this is the project management. This is the performance improvement tracker here. And then we have the project management view here. So pretty straightforward. And okay, going back to this here. Oh boy. Okay. All right. So, many of these slides, again, the reason why we have all of these slides here built in is that when you do get the slide deck, if you have to share it with other members or re-reference it, it will really break this down for you. All right. So I'm just gonna skip right ahead to some of the best practices. Is there any questions on the dashboard? Nope. Okay. All right. Well then, okay. So now what we've done is we've identified some kind of common pitfalls as it relates to performance improvement. We identified some tools to help with performance improvement with the dashboard, the project tracker, the performance monitoring, Gantt chart. And now we want to go over some kind of best practices as it relates to some additional kind of solving for some additional pitfalls related to driving performance improvement. A lot of times we hear from organizations where they the delegation is not something that happens, like everybody, it's one person that has all of the projects and all of the initiatives, and that's their responsibility, and nothing gets delegated. There's no shared ownership of any of the initiatives in the performance improvement work that wants to be done. Sometimes I hear it from the quality director, where they feel that they are the only ones kind of driving performance improvement within the organization because they're the quality director and that's their job. Quality improvement resides in everybody. And it shouldn't be something that's just in an office. It should be within, the whole organization. So, the delegating the implementation is certainly a pitfall there. Not designing a collaborative team structure. So again, it goes back to can't do it alone. If you don't have a collaborative team kind of rowing the boat in the same direction, change is not going to occur, or it's not going to come very easily. And so having that collaborative team structure is very, very important. Not engaging all stakeholders. I hear this a lot where, change and implementation of new initiatives only maybe happens in the department manager level. But what we want to do is we want to make sure that we're engaging all stakeholders, frontline staff, executive team. Sometimes we need to get medical staff involvement. We need to make sure that we're engaging all stakeholders to really drive change within our organization. You go into organizations that are very siloed, change does not happen very easily. So again, engaging all stakeholders and kind of breaking down some of those silos. Not managing a project plan, not having a plan or a clear direction certainly will kind of derail progress. A lot of times we'll see that a lot of the competing priorities really will derail a plan. It's okay if the plan changes, but if the plan does change, we have to kind of reorganize and remanage to the new plan, and have, utilizing some of the tools to make that happen and to kind of support the change within the organization. Communication, hear this one a lot, where communication and the frequency of communication is non-existent, and that will not lend itself to being successful. Where if you're trying to implement a change, implement a new initiative, create some type of performance improvement without adequate, transparent communication, likely not going to go very far. Lack of learning and innovation, thinking about having that continuous improvement mindset, that the status quo isn't necessarily always the best, in that we should always be seeking information. And it's I was always told, always ask why, why are we doing this? Or why do you do this? Try, continuously be that problem solver to really, get to that continuous improvement mindset. And so what are some of the, how do we shift from some of these pitfalls to really drive performance improvement? And we're going to go into detail about a few of these here, but establishing a change structure or a council, or some of the leaders in the organization that are really going to think of have that continuous improvement mindset to start to hone in and make some of those changes that are sustainable for the organization. Developing a charter for your action team. What are our guiding principles, or what is our vision for this team? having that collaborative problem solving, that kind of that team effort, communication, and having a plan as it relates to communication. And then the frequent celebration, it goes back to, celebrating the wins and really reflecting on the process and what, changes we may make, in round 2 or the next time. Again, it goes back to that continuous improvement. So, in detail to some of the items I just talked about is establishing a change structure. So, of our operational improvement team council, let's have different action plan teams, tying back to each one of those action plan tabs in that dashboard. Who's going to make up that action team number 1, 2, and 3? As we go through the action planning one-on-one with your organizations, it will start to kind of mold itself into maybe these action plan teams where you will have that established owner and you will have folks that are responsible for each one of those action steps. So maybe that is where we start to create these action teams that really flows up to that operational improvement team or council. And so for each action team, we want to define a charter. And we think of a charter as this nice little document, and we can, if you're interested, we can send out something similar to this that we use, or you can certainly just take this and make it your own just in a Word document. But really, you want to define, who's members of your team, and then who are the co-leaders, and what's the charter's effective date? When are we starting this team, and what's the duration? And you can go and kind of establish your duration of your charter and your action team based on your action plan. What is the purpose? We want to define what is our kind of our guiding principle, if you will, of our action team. And then what are some of the deliverables? So what are you asked to produce? And then of course, expectations of the members. What's the meeting frequency? We need to define that. Are we meeting once a week? Are we meeting twice a month? What is that meeting frequency? What is the time commitments? So very specific. It's almost like your bylaws of your board. Obviously it's not that robust, but it's an opportunity to really kind of set in stone what do we hope to accomplish, because this is if you don't have some type of organized team approach, then everyone can be kind of going every which way, and there's no kind of guiding principle for that. So we always like to say, develop some type of charter for your action team. And we want to. So here's some kind of best practices as it relates to collaborative problem solving. And for every council meeting that you have, or every action plan team meeting that you have an agenda. What do we hope to accomplish in today's meeting? Because then, having that agenda is really going to make sure that each meeting is strategic. And that we're not just wasting anyone's time, because I know time is certainly of the essence. So having a plan for each meeting. We have a neutral facilitator that's going to really help engage the members and keep them engaged within the meeting. Have meetings start. So again, very meaningful meetings that we're just not meeting to meet, that there is a desired outcome that's established, and we end with action plans. So whatever comes out of that meeting as an action plan, we talk about it at the end and say, okay, here's what the action plan is, or the action item, excuse me. And, so-and-so is responsible for it. Let's follow up next meeting. We expect that next meeting, you'll have some feedback related to that action item. Again, that continuous learning meetings are always debriefed. And so we like to ask at the end, what went well and what should be continued? Or in the inverse, what should be done differently? I know that we just started implementing at Stroudwater, ending meetings about what went well and what didn't. What can we improve upon? What can we do differently so we don't do it the next time? And that these meetings that we are having are of substance, and that it's not just a meeting to have a meeting. We want to always be continuously improving. And then this brings us to communication. So really some best practices around communication that will really help and support performance improvement is certainly around transparency. And again, transparent communication throughout the organization, top down, sideways, it really kind of ownership and engagement of all staff. And without it, there's silos that are created, or and that the communication flow and the opportunities for performance improvement and continuous improvement are non-existent. When we do have performance improvement, and you may always hear this, is that leadership is always trying to change things, and we just never know about it. At the front line, we just hear about it after the fact, or, oh, by the way, we changed this, or we're doing it this way now. And so, when we do have these initiatives and we're trying to establish this continuous improvement or this change culture, we need to make sure that it's cascaded throughout the whole organization and it's communicated in different ways, because we know there's not a one size fits all model in which communication is shared throughout an organization. Not everyone checks their emails. Not everyone attends their department meetings. Sometimes the department meetings are only held during the day and nothing gets communicated to the folks at night. So we need to make sure that we have this communication approach and plan for when things are going to be communicated about changes or implementations of new initiatives. And then certainly, it's that follow-up feedback or sharing progress with all stakeholders. So again, it's not just we're going to share the progress within the executive team, we're going to share it with everyone. All the key stakeholders, because sharing that progress with everyone is really going to contribute to the alignment and really drive the accountability and performance monitoring if we're sharing progress. And it's progress that's good or bad. If we're trending down, we still want to make sure that is shared. And then lastly, we really continuously what drives home and makes the hard work really resonate and what is around reflecting and celebrating the wins and having that continuous improvement kind of mentality to always be evolving, and not the status quo or is not where we always want to be. So we want to always every so often reflect on the performance journey. Where did we start and where we are today? It's always so nice to hear, and the center does a nice job about checking in with and doing these performance reviews and turning that review into a story of success, and really hearing where the organization was a year ago and what they've done relative to the initiatives and the performance improvement that they've gone through to get to where they are today. So really, nice to kind of celebrate those successes. And then always, celebrate the wins, recognize individuals that have really contributed to the success of the organization or the success of that initiative there. and do that frequently. It shouldn't just be a one-time thing. You know, if our organization is really, you know, celebrating the wins, it really drives and changes the culture, the mentality, that we are in a good place that really recognizes the work and the efforts of our team members. And then I think this is last bullet here is around getting ideas from all stakeholders, because you certainly one person does not have all the answers, and it comes back to collaborating and having a team approach to solving any of these issues or problems that you've set forth in your action items. And that having that team approach will certainly take forth a more innovative and shared learning experience. So continuously adapting to some of those changes will really set you and your organization up for that continuous improvement, and really help to implement some of the initiatives that you're going to develop for this project here. So with that, I think I have some time for questions, or I think that's it.
Please feel free to come off mute, or you can type your questions into the chat box. Lindsay, as of right now, we don't have anything in the chat box. So as we're waiting for folks to potentially think of questions, in just one moment, Caleb is going to be pulling up the slideshow again. I want to thank Miss Lindsay for your time as well as your leadership, as always. Before we conclude today's call, really we're asking these questions to really gauge how you feel about the action planning dashboard to drive that performance. The first two questions are the same, and then we added a third question. Also, if you have questions, please feel free to speak up or add those into the chat box. And I also want to thank the Delta program participants for joining us. I hope you found this session to be beneficial. And as always, please feel free to reach out to myself or really anyone from the center with any additional questions, comments, concerns. And on that note, someone put into the chat box, Lindsay, great information, thank you. And because I'm not seeing any other questions, I hope you all have a great rest of your day. Thanks again, Lindsay.
Thanks.
Bye.